This conference will now be recorded.
Hello, this is part 3 of public benefits. I will be discussing Medicare. I want to stress I am not an expert in Medicaid or Medicare. This is meant to be an educational overview. If you are considering any of these policies, I recommend you talk to an expert. For Medicare specifically, the company I refer everybody to is Boomer Benefits. However, I know there are many insurance agents out there who are comfortable and educated and familiar enough to send and to sell Medicare policies. So with that introduction, let's get started. So there's 5 parts to Medicare. When we get into the Medigap policies, you'll find that there's actually more than 5. The ones most of us are familiar with, I think, are Part A, B, and D. Part A is hospital insurance. Part B is your medical insurance. It takes over for you when you are no longer working at age 65 and older. This is your health insurance. Part C is going to be Medicare Advantage plans, which I'll give an overview on. Part D is prescription drugs, which is easy to remember because D for drugs. And then we have the Medicare supplement or Medigap policies, which will have additional letters. So to be eligible, most people will apply for Medicare when they turn 65. Medicare Part A, there's no fee, as I'm going to get into. You may also qualify if you are in end-stage renal disease or if you've received SSDI for 24 months. Now, for those of you who are watching this webinar and you have a child receiving SSI that you think is going to qualify for the disabled adult child benefit, this is who the Medicare can apply for. Let's say they are receiving SSI, they're found to be disabled before the age of 22, they're approved for Medicaid. Then at 19, let's say when you retire, your child is 19 years old. When you've retired and you start collecting Social Security, then the child's SSI will switch to SSDI. 24 months after they start receiving Social Security disability income or disabled adult child benefit, they qualify for Medicare. And you can look into the Medigap or Medicare Advantage plans. Of note, if you are a military veteran and you are using TRICARE for Life, or your child is receiving is enrolled in TRICARE or one of the TRICARE programs like Johns Hopkins Family Healthcare Program, you need to enroll in Medicare to maintain your eligibility for Johns Hopkins or for TRICARE. That's really important to note. There may be similar requirements if you're a federal employee or a state employee. Those are worth looking into. Just keep in mind that if you have a health insurance the rest of your life tied to your retirement, you may be required to get Medicare Part A, not necessarily Part B, to maintain eligibility. So Part A, generally there's no premium. However, if you have not paid into Social Security, you may have to pay a premium. It covers inpatient for hospitals and limited home health services. I want to make sure I stress, it will not provide, it will not, absolutely not pay for long-term care services. To get long-term care services like nursing home care or assisted living, you either need a long-term care insurance policy or you have to be so destitute you are using Medicaid. Medicare does not pay for those. Medical insurance, Part B, premiums start at $144.60 a month in 2020. They look back at your income the 2 years previous. So for people filing for Medicare Part B in 2020, they're going to look at what your income was in 2018. So conceivably, your premium could decrease, could lower, could go down as you get older and you get further away from your working years. Now, most of us aren't going to have to pay more in premium, but for those of us who had higher incomes, we are going to be paying more than $144.60 a month. This is where you can talk to your financial advisor when you're doing a financial plan, or you can go to the Medicare website to get an idea of how much you're going to have to pay. The things it covers are on here, outpatient care, preventative services, etc. What's important to note, if you do not sign up, there is a 10% penalty if you fail to. So if you become eligible at 65 and you're not working and you don't have health insurance through an employer at 65, and you wait until you're 66, there's a 10% penalty. If you wait until you're 67, there's a 20% penalty. It stacks. It gets very, very expensive if you don't sign up. So what I tell people is, if you are working and you plan on working beyond age 65, sign up for Medicare Part A right away. No harm, no foul. It doesn't cost anything. The year that you think you're going to be leaving your job, enroll in Medicare Part B. Yes, you're going to be paying premiums for 2 insurance companies for a period of time. If you retire in June and you enroll in Part B in January, or whenever the open enrollment is, then you pay the 2 premiums, but at least you're not going to run the risk of forgetting to sign up when you retire or thinking you don't have to. Part C, not everybody is going to get a Part C. It's Medicare Advantage. The premium is going to vary by the plan. They work like an HMO or a PPO. You may have to get referrals to go see the doctors that you want to see, specialists. You may not have to. If you get a Medicare Advantage, it will provide Part A and Part B. It'll provide the hospital insurance and the medical insurance. Some of them will provide vision, dental, and prescription drugs. Some of them will cover hearing. You have to be very careful to look at what those plans cover. And just because something is covered this year does not mean it will still be covered next year. These plans can change annually, and it's really important that you look at what you have, and if your needs have changed. If you've suddenly gone on a more expensive medication or something, and now this isn't working for you, or maybe you're seeing a doctor more frequently because you have cancer and now you have follow-up treatments, you may want to go in and revisit and pick a different plan. You can do these for your disabled children as well. Again, I would stress, if they've qualified for Medicare, and you'll get a letter in the mail telling you that they're eligible for Medicare Part A and Part B. The key thing to do is these are very difficult, and there's so much information out there. I really encourage you not to try to pick these by yourself. This is not something I or planning across the spectrum are very, very good at helping families pick. This is something you're going to want to talk to a professional who all they do is Medicare. Again, my personal preference is Boomer Benefits, BOOMER, and in benefits. However, there are insurance agents. If your advisor recommends somebody, certainly talk to them and see what happens. You should not be paying anybody who is selling you a Medicare Advantage or supplement plan. You should not be paying them anything. They should be getting paid by the insurance company that's providing the plans that you enroll in. Part D is going to be prescription drug. Again, premium, the cost that you pay every month is going to vary by the plan that you're on. It's important to know not every plan is identical. Not every plan is going to cover every medication. If you have relatively few medications, this probably isn't that big of a deal. But if you're on a lot of medications, maybe you have high cholesterol, high blood pressure, anxiety, etc., you're really going to want to be paying attention to what the insurance company's formulary is. What are the medications that it'll cover? Will it cover only generics, or will it cover the name brands? I provided an example of how costs are. This is in addition to the premium. You know, you may have co-payments. Again, it depends on the plan. This also has a late enrollment penalty. The amount could change. It's based on Medicare, a formula Medicare has, and it's 1% of something that Medicare figures out. And so if you're going to need this, again, this is something you're going to want to enroll in at 65 if you need it. And make sure you're not going to, I would encourage you, if you're not working or you don't have health insurance through an employer, to go ahead and enroll at 65. You can enroll 3 months prior to your 61st birthday, up to 3 months after. So if your birthday's in June, you can enroll in as early as March, and you can enroll as late as September. And then just like the Medicare Advantage plans, what the Part D companies provide and cover may change from year to year. So you're going to want to look at this, and you're going to want to look at what medications you're on, because that may have changed from year to year. So that's the first four, A, B, C, and D. Medicare supplement plans, also known as Medigap, has a whole host of other plans. You can see them on the left there, A, B, C, D, F, G, K, L, M, N. Medigap plans A and B are not, don't confuse those with Medicare Part A and B. They are, what it means is the supplement will provide different things, and you can see what they'll pay for over here. So if you're thinking of going on foreign travel, then the policy, you know automatically, if you know you're going to be traveling overseas or taking a cruise that will have a port of call overseas, perhaps you're going to go on a cruise that's taking you to the Caribbean, and you're going to end up in Jamaica or Cozumel or whatever. I'm obviously geographically challenged, but you're going to want to look and say, okay, I know that I'm going to be taking a trip overseas, so I'm not going to get Medicare Part A, Medigap Part A, B, G, or K, or L. If I get one of these other ones, it's going to pay, up to 80%. If you're worried about paying a Part B deductible, because maybe you have a lot of medical appointments and you just want to make sure that you get co-pays and you want to get paid the deductible. Well, the only one that pays the deductible is going to be Part D or Part F, Medigap F. Again, these are not the same thing as Medicare. These are Medigap supplement plans to replace or to fill in the hole of what is not paid for by Medicare Part A and B. So it's really important that you talk to a professional on this. If you live in Massachusetts, Minnesota, and Wisconsin, these standards are going to be different. You're going to want to make sure you talk to somebody who is in those respective states and very familiar with those respective states. Be careful when you're trying to decide, should you do a Medicare Advantage or Medigap. You may do a Medicare Advantage this year and then a Medigap next year, but you're going to want to talk to a professional before you make those decisions. This is meant to be a very broad overview, what the different types of Medicare are, what they do, and I wanted to introduce you to the fact that if you have an adult child with a disability who's under the age of 65, they may be eligible for some of these. And you may want to consider, if they are on Medicare already, you may want to consider looking into a Medigap or a Medicare Advantage plan for them to help offset some of the additional costs that you have. So again, my name is Eric Jorgensen. My email is eric@planningacrossthespectrum.com. This is meant to be a brief, less than 30-minute overview. It's not meant to be a comprehensive deep dive, because I think I could spend hours and hours on this. I just really want to introduce people to concepts. I want people to get familiar with with terms and some of the language and some of the opportunities that are out there, please consult with a professional, especially with Medicare. Thank you and take care.